Hi, my name is Dr. Ja'far Rashid. I'm periodontist. This is my second lecture on the influence of systemic condition on periodontium. As we know, all blood cells play an essential role in the maintenance of healthy periodontium. White blood cells are involved in the inflammatory reaction and are responsible for cellular defense against microorganisms, as well as for the pro-inflammatory cytokine disease. Red blood cells are responsible for gas exchange and nutrient supply to the periodontal tissue, and platelets are necessary for normal hemostasis, as well as recruitment of cells during inflammation and wound healing. Consequently, disorders of any blood cell or blood-forming organs can have a profound effect on the periodontium. Certain oral changes, such as hemorrhage, may suggest the existence of a blood dyscrasia. However, a specific diagnosis requires a complete physical examination and a thorough hematologic study. Comparable oral change occur in more than one form of blood dyscrasia, and secondary inflammatory change produce a wide range of variation in the oral signs. We discussed about the endocrine. Today we are focusing on the hematological disorder and immune deficiencies. And we take a leukocyte, especially neutrophil disorders. Disorders that affect the production or function of leukocytes may result in severe periodontal destruction. The polymorphonucleus, like neutrophil in particular, plays a critical and a crucial role in bacterial infection because polymorphonucleus are the first line of defense. Quantitative deficiency of leukocyte, especially neutropenia or agranulocytosis, are typically associated with a more generalized periodontal destruction that affecting all the teeth inside the mouth. So we are talking about neutropenia. Neutropenia is a blood disorder that results in a low level of circulating neutrophil. It's a serious condition that may be caused by a disease, medication, chemicals, infections, or it may be idiopathic condition or hereditary disorders. It may be chronic or cyclic, severe or benign, and it affects as 1 in 3 patients receiving chemotherapy for cancers. So, neutropenia increase the risk of bacterial supportive infection and not parasitic or viral infection. So it's one of the conditions that affect the aggravation of periodontal disease and further destruction of periodontal tissues. The second condition, we have agranulocytosis. It's a more severe neutropenia involving not only the neutrophil but also basophils and eosinophils. So we have here a more severe form of leukocyte deficiencies. The etiology may be drugs or infection. The clinical feature involving multiple necrotic ulcers covering the dirty pseudomembranes and of the buccal mucosa, tongue, palate, and tonsillar area. We may see severe necrotizing gingivitis, and the lab test shows white blood cell count and bone marrow aspiration. When we do these two tests, we may see with the clinical feature, we may approve that this is agranulocytosis or not. And the treatments including antibiotics, white blood cell transfusion, granulocyte colony stimulating factor, or granulocyte macrophage colony stimulating factors. This is also affecting the gingival tissue and the periodontium as general, and the occurrence of general aggressive periodontitis has been described in patients with cyclic neutropenia. So it's associated with a more severe form of periodontal destruction. We have another disease which is well known, which is a leukemia. Leukemia, or it's a British, or it includes both American and British accent of leukemia. We have both of it, with an increased A in the British one. And in the Greek, it's a leukos, which is white. Aemia, it's a blood. It's a cancer of the blood or bone marrow characterized by an abnormal increase of blood cells, usually leukocytes, white blood cells, and leukemia is a broad term covering a spectrum of disease. It's a part of the even broader group of disease called hematological neoplasm, but it's considered as a risk factor in periodontitis. So in cases of leukemia, the oral manifestation, we may see gingival swelling, spontaneous gingival bleeding, mucosal swelling with loosening and exfoliation of teeth, multiple ulceration of the mucosa of the cheek, lips, and sides of the tongue, and sloughing of the epithelium of the attached gingiva, because you may see the gingiva as a glossy, bright, reddish or dark blue gingiva, and multiple candidiasis and leukemia deposits, purpura and petechiae, and anemia, cervical lymph node enlargement, and leukemic infiltration of salivary and lacrimal glands. So these are the effects of the leukemia on the periodontium as general. It's not a causative factor of periodontal disease, but it's one of the diseases that, despite its aggressiveness as a whole body, which affecting the whole body, and it's a fatal disease, sorry, we have oral manifestation like you may see, for example, congested in deep dark blue, bluish or red sloughed gingiva, and sometimes there's a spontaneous bleeding without any touching, without probing. So they need extra care and supportive treatment, and to be followed under the supervision of the physician to get an optimal result. So this is my lecture for today, as the effect of hematological disorders on the periodontium. Hope you like it, and please subscribe to my channel, Dr. Harim Ja'far Hamar Rashid. Thank you for your listening.